Right now we've got, we know that the Morpheus is coming in terms of lectures, but you can get that on your Optimus. We talked about the laser hair opportunities. We talked about some skin texture and tightening opportunities. Now we're going to talk about discolorations. If you're doing anything in the skin world, we should be able to treat sun-damaged skin. So when we're looking at sun-damaged skin, that is a dyschromia, that is a discoloration that's happened because of sun damage, and now we have a filtered light that can correct that. On the new Optimus Max, it's 25% more powerful, which again just yields more efficiency. It means more efficient. So the Lumecca is, it comes in two varieties, a 515 and a 580, depending on your patient's foundational skin type. So it can be used on lighter and darker skin types. With darker skin types, we're seeking dark pigment. So again, can be done. Just got to alter your settings for safety and then use the 580 handpiece. 580 is more designed for your darker skin types. Before and afters. If you don't have IPL, again, this is foundational for an aesthetics practice. Picture left is sun-damaged skin. Picture right is cleared skin. This is after 2 passes, but 1 treatment. So 2 passes in the same treatment. The thing I love about IPL is it's very tangible. Like a lot of things that I do personally, especially my surgery, it's weeks, if not months, before we're getting your final result. Right, face tight. I mean, it's a ways to get your result. All of you have IPLs, you know. You go home that night and you see all the brown pigment like come to the surface. Your patients will be texting you. Of course, you educate them that this is normal. It's very tangible, like, oh my gosh, that thing did something. You can see it that day. And then it starts to flake off for the next subsequent days. This is how the IPL works. This is immediately after treatment. You can see all the brown coming to the surface. This is a 515 filter, 2 passes. Feel free to take pictures of all these. They've been consented if they're up here. If they haven't been consented for media use, I've got a few pictures that consented for educational purposes for medical providers. They just don't want it on social media. I'll draw your attention and ask you not to take pictures for those ones. But otherwise, if I don't say anything, just assume you can take pictures of the settings. Age spots. Since Donald Trump was running this year, he decided to come in and get an IPL for his rosacea. She's like, is that really Donald Trump? No, it's not. This is, but the first time I saw that picture, that's exactly what I thought. Okay, you can also use it for vascularities, red, ruddy hue, rosacea. That's what this is. So let's think about this. So we have browns and reds that can be treated with our IPL. Occasionally some vessels will get picked up, but I use the IPL first for the red foundation. Okay, so this is before, treat IPL, clear the red foundation. This is after a few days, and then look, we have nice clearance. Far right picture, nice clearance, but look what still exists if you look really hard. See that? Still have a little vessel. Didn't clear the vessels, but got the foundation. Start with your IPL, finish with your vasculase. The next one we're going to talk about is a vascular laser specifically designed for vessels of caliber, like these little spider veins or angiomas or things of that nature. So IPL first to clear the foundation, vasculase to clean up any residual little vessels of caliber. Same thing here. I would have counseled this gentleman, hey, we might need to clean up crew on aisle 9. We're going to IPL first, and then there might be a few, but he actually did great from picture left to picture right. No vasculase needed. Sun-damaged skin, just treated, untreated. This is my wife's arm after we do the lake a bunch and the beach a bunch. And so every October, this time of year, she's like, just IPL me from my eyeballs to my toes. And so she does her face and her neck and her décolleté. This is showing you the contrast. Last week before this picture, the week before this picture, she had done her shoulder and décolleté. So that shows you the clearance. This day, that morning, she had done the remainder of her lower 2/3 of her arm. So you can see cleared skin, treated skin same day, and you can see how much comes to the surface and then subsequently just peels off. Surgeons in the room, where are you at, surgeons? Awesome to have you guys. You're living in the same world as me. Everyone wants what they want, and they want it now, which is oftentimes hard to deliver on. And everyone wants the scar on the right, but they want it at 6 weeks. And you know and I know that's just unrealistic. Everyone's scar looks like this, and everyone will complain about it. And then they tell me, I got keloids. I'm like, first of all, no, you don't. You're not even in the right ballpark. At best, it's a hypertrophic scar, but this is just a normal scar, right? And then you're doing all the education at 6 weeks. And really, it's hyperemia. While this scar is trying to heal, it's influxing a ton of blood supply to heal that wound. And then you get a pink scar. That's very appropriate for 6 weeks. Our patients want this, though, right away. So I started IPLing them. And I call it a scar refinement. It's not we intentionally call it a scar refinement because we don't want to give it like a negative connotation. If you call it a revision, to me, that just sounds like something went wrong and I need to revise it. So it's just a little refinement. It's just scar refinement because you can't be patient, basically. So we IPL our scars starting at 6 weeks. We charge for that if the patient wants. Just a little scar refinement package. I also use my IPL for bruising. This is a patient who was on blood thinners. Could not stop them based on her medical conditions. We did not get clearance from her internal medicine doctor to stop her blood thinners. She wanted a lower bleph. I told her, no, you don't need one. You are beautiful. Let's not do it because you are going to look like you got in a prize fight, Mike Tyson and what's his name, Jake, what's his name he fought last night? Jake Paul, yeah. You're going to look like you were in that fight if we do a lower bleph. She begged, and I said no again. Finally, on the third time, I was like, all right, but just know you're going to look like you've been in a prize fight, and we could have some, minor complications that are short-lived, and sure enough, here we go. I know, she asked for it and paid for it, so I was up front. This is kind of what we expected. So, but here's the thing, I've got an IPL, right? And so it's too early to do anything at day 1, but at day 7, now I can start working on cleaning up that hemosiderin and cleaning up the heme underneath the skin. And so we IPL'd her on day 7. There's the settings. That was 3 days later, and I IPL'd her again at day 10. Here's 2 weeks. I promise you at 2 weeks, we wouldn't have had that resolution if I didn't IPL her. She still would have been bruised in all kinds of colors. So I use it post-surgical frequently in my practice. And lastly, girls, we can come up for our demo, ladies.